today, Dr. Ryan Wolford, who I'll tell you about in just a minute. Before I do, I just want to tell you about this 10-day challenge that we are doing starting March the 1st. And we'll put a link in here so that you can see the video I did on it. And it's a short video, but explains it in detail. It's a 10-day challenge to where I don't care what you've got. I don't care what your symptoms are. Give me 10 days and we should be able to see a difference. Not that you're going to get fixed, but that you should notice, hey, wait, I slept a little. Oh, hey, I didn't have coffee today in the middle of the afternoon and I didn't fall asleep. Or, oh, hey, my headache was less today. It's bad now, but it was less, whatever it is. But we've come up with an idea here, and I've shot over 80, I think it's 84 videos. Many of them we're going to use here, and it's a 10-day challenge, and it's all free. So click the link below after, or copy it and paste it, and take a look if you want to. It starts March the 1st, and we're really excited about it. We've got thousands of people who have already signed up, and it's really great. I'm really looking forward to this. I've never done anything like this before, so it's a first time for us, and I'm very excited about it. I think you'll find it very, very helpful in whatever your health quest is. So I'm going to introduce our guest, and to make sure I get it right, I'm going to read a little bit about Dr. Ryan Wolford. He's a certified chiropractic sports physician and certified chiropractic biophysics physician. Now, biophysics is a branch or a specialty within chiropractic that is very sophisticated and gets tremendous results if the practitioner learns the techniques properly, which I know Dr. Wolford has. He uses a specific protocol for spinal and postural correction to break free from chronic pain, disease, and organ dysfunction. He's also a certified mindset specialist, helping people retrain the mind-body connection for optimal health and performance. And that's a critical component, is how we look at our pain. So for those of you who are here today because you saw that we're talking about chronic pain, welcome. I'm sure you're going to walk away with some great pearls today and some ideas on what might help. Dr. Ryan created a system that incorporates healthy lifestyle principles to break free from the dependence on a very broken system, be your own guarantee for your health, and make natural pain-free living possible. And with that, I'm going to say, Dr. Ryan, welcome so much, and thanks for being here today.
Thanks for having me, Dr. Tom. I loved hearing about your 10-day challenge. It's, it's amazing that people look at wanting, like, especially with pain, for example, because you mentioned headaches, right?
Yeah.
And they think it's all or none as far as, okay, I either have a headache or I don't, or I have pain or I don't. And yes, we want to be pain-free, but we want to live in a lifestyle that is conducive and predisposes us to a pain-free life. And it doesn't mean we're going to never have any injuries or aches and pains, but what are we doing to help, one, avoid it on a daily basis or a regular basis? And yeah, this 10-day challenge sounds amazing to help people just realize, and just even how you said it there. I'm sorry to go off on a tangent, but I wanted to give you props for that, because, okay, maybe usually my headache's a 9 out of 10 in severity, but for most of the day it was a 5. I mean, that's a huge win. And that's the whole mindset part of it.
Huge win. One of the things we're going to talk about, and I'm going to reference it because it relates directly to your topic, which is chronic pain, is that chronic pain came on over time. There may have been an initial incident like a trauma, a car accident, or something like that. Or for those that can't identify a specific incident, this example I'm about to give is even more relevant. And that is, we've all seen the cartoons about a snowball rolling down a hill. And as it goes downhill, it gets bigger and bigger and bigger. The imbalances in our lives, whether it's structural or chemical or emotional or electromagnetic, the imbalances in our lives that knock us out of balance starts the snowball going downhill. And we don't feel it when that first begins. You know, there's a little annoyance maybe, but usually you don't feel anything. But as the snowball goes downhill, it gets stronger and stronger and bigger and faster and faster. All of a sudden, we've got some problems that we want fixed. There is no way you're ever going to get this to occur and your pain goes away quickly. But if you have a herniated disc, you get surgery. And of course, that really helps. Then there's a recuperation period. But in general principles with chronic conditions, what you have to recognize, something in lifestyle contributed to this, something in my lifestyle. And if you knew what it was, you change it, but you don't know what it is. But something in lifestyle had to push this snowball down the hill. And what you have to do is take lifestyle interventions and slow down, reduce the speed of that snowball until it tapers off. And then you can start rolling it uphill and reduce the pain. So Dr. Ryan has an event coming up, a chronic pain summit. And one of the things I really liked about it, I was surprised, is that there are 6 experts on this summit, not 36, 6. Which means it's manageable. It's not going to cause stress in life. And what I want to know, Dr. Ryan, a couple of those names I recognized right away, like, oh, great. Oh, nice. But how did you choose the experts that you chose to interview for the Chronic Pain Summit?
Honestly, I looked in my life and the groups and the circles that we run in, and I picked 6 because, like you said, I wanted it manageable. I didn't want, I'm part of the summit model. I love summits, so I wanted to make more of a master class, an actual class where people can learn how to use this lifestyle system and also ask questions during it. Because it started off to where it was going to be a recorded thing, but then I talked to a few of the experts and they like, you know what, let's do it live. So then we could have it just very similar to this Facebook Live where they can ask questions where they like, so here's the format for it is I'm going to do a little warm up with the attendees for about 5 or 10 minutes to prime them, to get them ready. And then the speaker is going to come out, whether it's about sleep, about the actual neurology of pain in the brain. Because one of the main questions I get asked every day in some form or another is why do I have this pain? And you alluded to it as well. Is like, sometimes we don't know why we have this pain or why it developed, because it doesn't happen overnight and it's not related A to B with some sort of traumatic accident. It might have been 15 or 20 years ago, but yes. So we do that. I 5 or 10 minute warm up. I basically let the speaker, let the expert do their thing, explain the science behind the topic, whether it's nutrition and detox, whether it's sleep, whether it's mindset, and then they get into the application of it. So why I chose these individuals, because I know they have processes and systems that work, because I wanted to basically, I told them, like, I want you to give them your protocol, essentially. Tell them what to do for their sleep hygiene. Tell them what to do with their spinal hygiene and exercise. Tell them what to do, a literal do this roadmap instead of trying to piece it together themselves.
Right.
So we're doing it live from February, like 2 speakers a day, February 28th, March 1st, and March 2nd. So it corresponds very well with your 10-day challenge as well, because I know your start's on the 1st. So, but I'm also recording it. And when you attend, you also get the recordings as well. And you can ask questions during the event of the individual experts.
That's a game changer. That's a game changer compared to all the other summits out there. And I want to congratulate you on breaking the model and doing this, because this sounds much more interactive with the attendees. We got some questions already that relate to this. So Louise is asking, do you have any recommendations for shingles nerve pain? How would you do that?
Well, one, the shingles nerve pain, And you're probably going to get sick of me pointing back to the things that you mentioned, Dr. Tom, of the physical, the chemical, and emotional, mental type stressors that are being placed into our, let's call it our stressor bucket. And you mentioned that snowball. And with shingles, with, especially nerve pain and neuropathy, because we don't know, my daughter's coming in here to get her backpack.
Oh, that's great. She can come say hello.
You want to come say hi to thousands of people? Okay.
Dad, no.
But exactly. She's 16, so you can imagine she wants to come on camera for sure.
Right.
It's a simple answer, but it's not always like an easy fix.
Right.
Especially when we're talking about the nerves, because obviously as a trained chiropractor, especially in chiropractic biophysics, CBP for short, we look at the spine and posture as a cause, and like poor posture, poor spine, poor spinal hygiene as a cause of those nerve problems. And usually, again, with shingles, it's a multifactorial cumulative effect of the different stressors that we place into and onto our body. So we have to look at the physical stress and we'll keep it simple. Let's look at your posture. And what was the name again of the question? Luis. You have to look at your posture. And one of the best ways to look at that is look in a mirror. And let me go back. Not necessarily look in a mirror. You can set up your phone. You can have somebody look at you because it's really simple. More often than not, people tell me, oh, my posture's horrible. And usually what they're talking about is this hunched over, slumped over posture. So if you're like this, it's putting a chronic stress and strain on your spinal cord and the nerves. And it depends on where the nerve pain is, the shingles. So that definitely needs to be addressed. When you look at the spine and your posture, because your posture, it's a window to the spine and nervous system. So anywhere that your posture is distorted means that somewhere that the spine is injured, damaged, or weakened, and now it shuts down that communication from the brain to the body through those nerves and the nervous system, and then back up to the brain as well. It's this communication superhighway going back and forth. So that right there, and there can also, so that's like a physical stress. So looking at you from the side, we want your ear, and I'm going to turn to the side a little bit. Hopefully you can still hear me. Ear, shoulder, to make it simple, outside of the hip, and your ankle bone to be in a straight line. So that's like the overall posture that you want. If you notice yourself doing things that is causing that slumped over posture, like on your computer, sitting down with maybe your laptop or iPad or whatever on your lap, holding it down, holding the phone down, and it's creating that chronic strain. Well, if you continue to do that, it's going to snowball and basically stick.
I'm going to take this opportunity to give a demonstration of what you were just talking about. I'm on my computer many hours every day. That's my work. And I just got this thing, finally, that I use. Now, I'm going to have to move my computer, so the camera's going to jiggle a little bit, but I want to show you guys that I just got this little frame, this metal frame thing, and the computer sits on it. And when it sits on it, so if I put this down without the computer, and so now my head is actually having to look down a little bit. And that's putting a little bit of a strain on my neck. Not a lot, but a little bit. And so I'm going to put this frame now back there. And so you can see, because Louise, I want you to understand what he's talking about here is that it's the subtle little things. Now I'm on the frame and I'm looking straight ahead. And so I'm on the computer for hours and hours every day. And that minor little thing may be an aggravator that is contributed to this. Now, my answer to your question is Structure is going to have a contribution to the tension and the mechanics of how your body's functioning, and it can cause more inflammation. But in my practice, and perhaps it's different for Dr. Ryan, I've never seen structure be the primary cause of shingles. I've never seen it. It may be, and I've heard some docs talk about that, but I've always talked about structure as a component. But when my mother got shingles, she was 66. And I was thinking about this as Dr. Ryan was talking, that, my God, I'm 70 now. Wow. Mom was younger than me when she was sick like that. You know, I just realized how young she was by my standards, but how aged her body was. And the shingles went on for months and months. She tried everything. And then finally she did what I said to do, and it worked in 3 days. And this will help with the pain. This will not help with the cause. So once again, I'm not your doctor. We aren't recommending specific treatments, but this is something that I've done many times for shingles. There's a substance called Dmso, and you'll find it online. Just Google it. Amazon's got it. And you dilute it 50-50 with distilled water. And when you do that, you put some in a glass and you add distilled water to it. And the bottle that you put it in, like an eyedropper bottle, it's going to get really hot. Don't worry about it. It's fine. Just chemical reaction. And then you take a couple of aspirin, grind them up to a powder, mix them in the little eyedropper bottle of Dmso and distilled water, and then you apply it. Now, Dmso, you apply it to the area of pain, but just not around your eyes. My mom was around her eyes and on her chest. She had it in 2 places, and the chest pain went away immediately. I wouldn't let her put it around her eyes because I don't want any accidents to happen. And when I went to visit her, I went from Chicago back to Detroit, and I applied it on her. I said, lay still, don't move. You know, and held her head so she didn't move. And then I put the drops on, right? And then that pain was gone in a couple of days. And you can apply it 2-3 times a day, but it's a temporary fix for a chronic problem. You don't have a Dmso aspirin deficiency that caused this. But when you're suffering and you need something, this is the kind of thing that will help. But then you got to look at, all right, where did it all come from? Okay, I guess, yeah, I've got the slump posture thing, or I'm going to work on that so that that's not a weak link in my chain anymore, right?
Right. Exactly. And I was leading with that just because I know not a lot of people hear about that. So I want to expose them to that as much as possible. I totally agree with you, because the patients who come in and they have that as maybe a secondary symptom, like shingles or with the nerve pain from the shingles,
right?
We always address the posture, but we also talk about like nutrition and like detoxification, which is essentially what you're talking about there too. And it buys you time for your body to heal while you're fixing the lifestyle. And people will have to excuse me because I always come at it from a lifestyle perspective.
Yeah, no,
right?
that's not something to apologize for. That's not something to apologize. It's not what people want to hear, but I'm not here to be your friend. You know, I'm here. I'm here to give you some guidance.
Right. And I remember you talking about it because you were on my Superhuman Brain Masterclass like 3 years ago, Doc. And you were talking about when you're basically trying to survive, you're drowning. Guess what? You're going to need a life preserver. You're going to need something to help hold you up while you can get out of that lake situation. And that's what the Dmso, the aspirin, that's what that's for, until you can stand on your own 2 feet on land. Yes. Right. So definitely, Louise, that's like Dr. Tom. He's awesome with the nutrition, the detox, with in nutrition. You already know, if you're following Dr. Tom, get off the stuff that's causing the inflammation if you haven't already. You know, the gluten.
And actually, Louise, this 10-day challenge will help you a lot also, because I'll talk about those basic food things, to reduce inflammation quickly. That can help. Maggie's on Facebook, and she's got a question. Can you help me with arthritic lower back pain? L4 and 5, steroid injections, stretching, physical therapy, not helping much.
I don't doubt it. That that's not helping much. Like especially with the steroid injections, the drugs, even surgeries. Because what happens is it's not addressing the cause. Again, we've heard this before, I think, it's masking it. It's like the fire alarm's going off, trying to give you a signal, and we're taking out the smoke alarm. And it might work for a little while for the pain, but it's not fixing the cause, which goes back to, especially with arthritis, low back, steroid injections, inflammation is building up. It's irritating the nerves. It's, I don't know if it's probably not pinching the nerves, but it's irritating, creating chemical changes around the nerves, with sending the signal up to the brain saying, all right, there's something wrong going out down here. And that's where this postural and spinal technique is so great, because where a lot of these spinal issues, pain, neck pain, back pain, headaches, numbness, tingling down the arm, stiffness, it comes from the posture. Think about if your car is out of alignment, like mine was a couple weeks ago, and it's causing irregular wear and tear, not just on the tires, again, like the spine, but it's causing the engine to work harder. So it's causing disease in the engine. It's causing that not to function like it should. So think about this. If your posture is in a position where, again, I don't know if you can see me with this, but if you're shifting your body to the side, because this is a posture that not many people even consider. If you're sitting off to the side, or even just standing, or have had an injury where you get antalgic and then it sticks there.
Well, let's do it right now. Everyone who's seated, is your weight evenly on both buttocks, on both cheeks? Just close your eyes for a minute. Is your weight a little bit more on the left side? Is your weight a little bit more on the right side? And if you're standing, or if you're driving, that's always the case, because one foot is up to push on the gas pedal, the other leg is bent high up, and so your hips torqued a little bit. Just feel your butt. Where is the weight in your butt right now? And if you have chronic pain, that's just a classic indicator of what Dr. Ryan is saying. Say, oh yeah, but, or when you stand, most people, when they stand still, they bend one knee. So you're throwing one hip out more than another. That's just common stuff that we've all done in our lives.
Yeah.
So
exactly.
The first thing I want to say, Maggie, if you've got L4-5 pain, let me tell you, I was tackled from behind in the 3rd grade, and I cried and cried because of back pain. Turned out my father was in the hospital at that time in traction for back pain, low back pain. So they thought I had sympathy pain going on, and I was ignored. And I cried, I don't remember how many days, my back hurt. It wasn't until I got to chiropractic school and we took x-rays for the first time that I saw. Now watch Dr. Ryan's face when I say I've got a bilateral spondylolytic spondylolisthesis grade 3 at L4-5. That is like, what? That is a very unstable low back, very unstable. But I have no back pain whatsoever, because I learned in my 20s what aggravates it. And what it means, from a side angle, your spine has 4 curves. There's a curve in your neck, in your upper back, going down to the low back, and then, oh, there we go. Yeah, from a side, there's 4 different curves. And what's happening, the second bone from the bottom for me has slid way forward, 75% forward off of the bone underneath it. And that
I can't do it on this, but yes.
Right. And I've just grown up with that, but I learned early, in my early 20s, and I had back pain in my teenage years, but I just kind of adapted and tried different things. And But in my early 20s, when I saw what I had, I just figured out what to do. And I have no pain whatsoever. So it certainly is possible. But you have to first see, if you don't know what you got going on, there's no way you're going to embrace the lifestyle changes that are required to fix it. Doesn't make any sense to you, right? So you have to find out what's going on. You have to find a practitioner, not just who's focusing on giving you pain relief, which is really important to get pain relief, but why is this happening to me? Are my tires out of balance? Is that why my steering wheel keeps pulling to the right? Or am I low on water? Is that why there's steam coming out of the engine, out of the radiator? You know, you have to figure out why this is happening. So you need a practitioner, Maggie, who can evaluate you from a mechanical perspective and that makes sense to you. Someone that's not going to talk gobbledygook, but someone that says, well, you know, this is going on and this and see here. And if it makes sense to you, so that you say, all right, I'll give this a shot. I'll give it a shot. And then you apply 100% to giving it a shot.
And a couple things there, Maggie. And if you're looking for somebody, I'm not sure where you live or where you're located, but if you go to idealspine.com and look up, that's the CBP directory, and how Dr. Tom was talking about looking at the structure. That's what we do. We have to look inside and under the hood, look at your spine. And if they're trained in CBP and chiropractic biophysics, and they've had a good amount of training, it's a very sophisticated technique that, 1% of the chiropractors do, but it's also one of the most researched techniques as well, and shows how that, by correcting those curves that Dr. Tom talked about, it takes stress off of the spinal cord.
And you've got the founder. You've got the founder.
What's that?
You have the founder as one of your guests for your pain summit. So so everyone's going to be able to hear it from the horse's mouth.
Yes.
Right?
Yeah.
And
so I just messaged them today.
Dr. Ryan, my question on what you just suggested, the website idealspine.com, is there a certification process that people have to go through? Okay, then Maggie, you want to look for someone that's certified, not someone who's taken one course or maybe two courses or a weekend. You want someone who's passed the test and they're certified. And that's a really good recommendation for a place to start to find somebody. Alice is on Facebook and she asks, omega-3s helpful for inflammation?
Yes. But it depends on you, but I would test it out and see. Omega-3s, very rarely have I found a problem with taking those, but you want to get a good quality omega-3. You don't want to just take the store-bought brand. I'm not a big fan of that.
Right. The GNC or the pharmacy stuff is not very good. It's garbage oils. They're usually rancid. They are. But the answer is yes. Especially the EPA component of omega-3s are anti-inflammatory. They turn on genes of anti-inflammation. But glutamine turns on genes to reduce inflammation in the gut that the omega-3s don't. Vitamin D turns on genes to reduce inflammation that the omega-3s and glutamine do not. Curcumin turns on genes that vitamin D, omega-3s, and glutamine do not. My point is, I doubt if you have an omega-3 deficiency that's causing your chronic pain. You certainly may have an omega-3 insufficiency or deficiency that's a contributor, and it's going to ease up the burden when you raise your omega-3 levels. But the way you find out, there's a simple pinprick red blood cell test that you do and look at your omega-3 index. It's called the omega-3 index. Just Google it. You'll find it. And it's just a pinprick, put a drop of blood in the card, send it off to the lab, and it'll tell you what your ratio is of the good fats to the bad fats. And that'll tell you immediately if you need more omega-3s. Now, my clinical experience, one more thing, my clinical experience is that everyone benefits from taking extra omega-3s. Everyone does. But it's not the primary thing you do when someone has chronic pain. It's to be included as part of a protocol, but it's not the primary thing. Dr. Ryan?
Yes. And I remember, I can't cite the exact study. I just remember writing this down as like out of a journal years ago, talking about how omega-3 is more effective than taking Celebrex for arthritic pain.
Right.
And this was a huge study that they did. And obviously less deaths or no deaths and, less side effects because of that.
Right. Agreed.
Mm-hmm.
Let's see. S. Wit on YouTube asked the question: Would you go over the amounts for Dmso mixed with aspirin again? Had someone at my door and missed the measurements. Wondering if you can use white willow instead of aspirin that aspirin is modeled after. I don't know about white willow. It makes sense to me. I think that's a good question. It's 50-50 Dmso and distilled water. Put it in an eyedropper, 50-50, then grind up a couple of aspirin, or you might use white willow. I just have no experience with that, so I can't comment either way on it. The logic is good on that one, but that's the dosing on the mix. Jill, hi Jill, on Facebook says, I had a frozen shoulder, which is finally much better after 1 year. Physical therapy didn't help. My orthopedist told me I can do some exercise at home, but it'll probably go away on its own, which it finally did. I had a cortisone shot, which helped a lot with the pain, but not so much with range of motion. How can frozen shoulder be prevented in the future? Dr. Ryan.
Oh, so the same things that we've been talking about, like these physical stresses that we're placing on our body, especially with frozen shoulder. If you've had an injury in the past or an injury that, set that in motion, maybe a sports injury or accident, whatever it is, or maybe you didn't. But we always have to look at the overall structure of your body. That's one of the things that can contribute to it, where, again, this forward rolled shoulder. So think about your shoulder. Whether you've had an injury or not, well, now the injury, I guess I would consider the frozen part of it. Now the immobility. Now, if you have immobility, that's going to turn off even more nerves, more proprioception. And now if it's also contributed, the cause was contributed by poor posture to begin with, where shoulders are rolled forward. So think about the ball and socket joint, your shoulder joint, right? That ball should sit in the socket, but that ball is actually bigger than what that socket is. And it's held there by the labrum and ligaments, the rotator cuff muscles, and also stabilized by different scapular, shoulder blade stabilizers. So I like to, tell my patients to think about the shoulder joint as a golf ball sitting on a tee, like that bigger size golf ball sitting on a smaller tee. So what happens if that gets out of alignment or out of the normal positioning? Now it's causing chronic stress and strain on the rotator cuff, on those ligaments. So you want to make sure, again, you asked how to prevent it in the future. It's not just working on the actual shoulder joint, but it's actually working on the scapular stabilizers, like between the shoulder blades, like different types of rows, but making sure that you line up that ball or put that golf ball back on the tee while you're doing the rows, squeezing the shoulder blades together. Okay, that's where you want to feel that, okay, as well as obviously the nutrition to make sure you're getting the raw materials for it to heal. But that is my number one suggestion for that. And you have to have a lifestyle of movement, especially if you've had a issue with that in the past. Now, for me, I actually it was this one. I think it was 3 years ago. It was my AC joint, but I limited the motion in it because I found a different way. I couldn't do push-ups. I couldn't do certain exercises because I got osteolysis of the distal clavicle because I overworked it and it started wasting away. And this is with people who do like maybe bench presses or a lot of push-ups. And if it's not stable in there, then it causes like the wear and tear on the AC joint starts to waste away. My point in that is, again, we have to make sure if we can't, fix something, or because that's what made Dr. Tom reminded me of that when he mentioned his L4 spondylolisthesis. It can come, like this pain can come from different things, or you might not even have pain, right? From that spondylolisthesis, like Dr. Tom, he doesn't have that because he is making sure that inflammation stays low in his body and finds ways to make sure that he stays active and make sure that it's not putting a chronic amount of stress on that. It's the same thing with any joint in the body, especially that what you can cause with like frozen shoulder or adhesive capsulitis.
I just listened to my mind saying, I really wish I could eat croissants. I miss croissants so much, but I'm not going to eat wheat because it's inflammatory. And I just know better. I would just suffer long-term quite a bit. So
hopefully that helped to answer the question. Just work on the stabilization, shoulders back, squeezing the shoulder blades.
That's a really good concept in an exercise. Right. Let's see. Michael is on YouTube. He says, since green tea has been proven to modulate genes that decrease intestinal permeability, what would a genetic sensitivity to green tea indicate about one's body? Let me read that again. Since green tea has been proven to modulate genes that decrease permeability, that's true. What would a genetic sensitivity to green tea indicate about one's body? It means it's a weak link in your chain. If you've got genetic sensitivities to green tea, don't drink green tea. And you have to find out what other compounds might activate those genes. So green tea is not a first tier treatment protocol for intestinal permeability. It's not even second tier. It's probably third tier, meaning, it's got some benefits. It's going to help a little bit, but it's not commonly recommended for leaky gut, for intestinal permeability. We recommend it often for a whole body anti-inflammatory approach. But if you're carrying the genes that give you a sensitivity, and I'm unaware of what those genes are, and I'm assuming that you've had some testing done, and so they've identified that you are sensitive to green tea. And by all, it's kind of probably like the genes for celiac disease. You're sensitive to wheat. Now, a third of the population has the genes for celiac disease. That means, depending on the paper you read, 30 to 35% of the population carries the genes for celiac, but only 1% gets celiac. And that's the way it is with any of these genes, like the gene for green tea, your sensitivity to green tea. It doesn't mean that you're going to get celiac if you carry the DQ2 or DQ8, or that you're going to get a symptom pattern if you're exposed to green tea. It means it's a weak link in your chain. And when you pull at a chain, it always breaks at the weakest link. It's at one end, the middle, the other end, your heart, your brain, your liver, your kidneys, your gut. Wherever your weak link is, that's where it's going to break. So a gene for green tea sensitivity is not preordained that you have to suffer. But it means if you pull on your chain too hard and then you're exposed to green tea, then you're going to suffer. Because a third of the population has the genes for celiac. What percent of them are eating wheat? 90% of them are eating wheat. They all don't have celiac disease. So this thing about a gene for green tea sensitivity, that's worthwhile knowing, but the bigger picture is don't pull on the chain. And what does that mean? All of the other lifestyle features that activate inflammation in your body.
Let me add one thing to that, because I love the weak chain, the weak link in the chain is we want to find that one thing that causes it to break. And it's usually not that one thing. And we're trying to,
right.
Like whether it's taking a supplement or getting rid of an offensive food, it's a multifactorial thing, just like you said with the lifestyle.
Right. Agreed. Hope that helped, Michael. Kay's on Instagram. Hi, Kay. Any recommendations on pillows for neck pain and sleeping positions? Really good question.
Oh, that is a great question. We're going to have a sleep expert, sleep performance coach on. His name's Angus Buckle, and he was probably one of that you were wondering about, Dr. Tom. He's a guy that I've worked with, and man, done great things with people's sleep. And what he's going to go over is that. But what I know he's going to say is it depends on the type of pillow that you're using, the type of bed. But in general, laying on your side is the most advantageous position, whether it's on your left side or right side. I personally lay on my left side a little bit more. And here's where that balance comes in, because I also lay on my back and I also lay on my side. I don't lay on my stomach anymore. Well, I did when I was younger and a kid, but that just cranks up your neck. And that's, if you do lay on your stomach, try to train yourself to lay on your side or your back. But with pillows, if you're a back sleeper and a side sleeper, there has to be that balance, because when you're on your side, you want basically it's supporting your neck and your head, right? And if you're laying on your back, you don't want it too thick to where it's cranking your head up and neck up, just like if you're looking at your phone or on the computer looking down, because that can cause a chronic strain. Now, so that's what you want to play around with, is find a soft enough pillow to where it's soft on your head. I have a sensitive head, I say, where I have to make sure that it's not too hard of a pillow, or else it can create headaches, or I might wake up with a headache because of the pressure on it. But find that to where it's supporting your head and neck in both positions, but not cranking it if you're laying on your side too far up, or you're like reaching for it like that. As far as
Great.
pillows, though, the brand, I'm not sure. It just depends on, I've gone through different pillows to find the right one.
Mm-hmm. It depends on the individual. Some people, a softer pillow works well. Some people, a little firmer support. It depends on the posture of your spine as to what your spine is going to relax in. I mean, the goal here is to get the spine to relax when you're sleeping, never on your stomach, What I usually recommend, go ahead. Go ahead, Dr. Ryan.
Go ahead. I want to give them a test to do whether they have a postural problem while laying on their back, but go ahead. I want you
Good. Okay, so take a towel, roll a towel up, put 2 rubber bands around it, and not a big bath towel, but you'll figure out the size that's best. And you start every night on your back with that towel under your neck and a pillow under your knees, so that your knees are bent a little bit. Takes a lot of strain off your low back. If you're not asleep, in 10 minutes, throw the towel on the floor, take the pillow out from underneath your knees, and go to whatever position you can to go to sleep. But every night you give it 10 minutes, and then you're going to fall asleep on your back with the pillow under your knees and this under your neck. And you experiment with different towels until you find the right support for your neck. The more rigid your neck is, the less it wants to go into what should be the most relaxed position. And so it depends on, well, how thick should the towel be? It depends. You want a little bit of support of your neck, not so much of your head, but you don't want the head falling over backwards. So just a little support, because you're supposed to have this curve in your neck. Your head is a 17-pound bowling ball, and it's sitting on top of 7 empty spools of thread. And the curve in the neck from the side view is designed like that. That curve is so that the weight isn't going all the way down to the bottom of the neck and all the weight's hitting your shoulder. So that curve, that side curve, is allowing some of the weight of the head to dissipate out between the first 2 bones, and then the next 2 bones, and the next 2, and the next 2. The problem is the vast majority of us have our heads in front of our shoulders like this. And then, of course, the shoulder rolling forward also. But as Dr. Ryan was saying, your ear should be over your shoulder on a side view, and just stand comfortably and ask your partner to take a picture of you with their phone from the side, and see if the center of your ear is over your shoulder, or is the center of your ear in front of your shoulder? And the more in front it is, the softer the towel has to be, because you're not going to get that thing to really relax very much at first. And over the months, it'll relax more and more and more. But the pillow under the knees takes a lot of pressure off of your low back. Dr.
And
Ryan.
that's the test to find out, where is this forward head posture coming from? Is it from actually the thoracic spine, your mid back, causing too much of a hyperkyphosis? So if you lay on the floor on your back, because you want a hard surface for this test, and if you lay on the floor and if your head doesn't even touch, or if you have to put something underneath your head and neck, like a towel, a rolled up towel or something to take the strain off of it, then you know that is, you're more than likely hyperkyphotic, too much curve in the thoracic spine, which is causing that to go forward. And what you want to watch out for is making that towel too big to lay on, and it's just creating, or just like support, you want it supported. And this is what I love you talking about, the curves of the spine, Dr. Tom, because that's what CBP is. It's restoring those curves in the posture to take the stress off of the nerves, off of the spinal cord and the nerves that are going to every single cell, tissue, and organ in your body, and can create pain, chronic pain, because of the stress that it's causing. So try that, because there's actually been studies in the Annals of Internal Medicine, in Journal of the American Geriatric Society, showing that an increase in that thoracic kyphosis, the thoracic hyperkyphosis, is a predictor for taking almost up to 15 years off somebody's life. Not that it does, or it's going to take it off everybody's, but it's a predictor of it because of the stress it's placing. What they showed is the stress it's placing on the heart and the lungs.
What he means by that geek language, which I fall prey to doing all the time myself, is when your upper and mid back are going backwards a lot, and your head's and your shoulders are going forward. And that
basically that hunchback, the hunchback posture.
Right. That's the exaggeration of it. But, and, the biophysics and having the founder on his summit is a big deal for everyone that's got chronic pain, to just listen to how, because when you're in the space of a founder, they've been their whole life, they've been breathing this for decades and decades, and the language they use, the examples they give are just so easy to understand, usually, that it just makes sense to you. It really makes sense. Let's see, Samantha's on Zoom, and she asked, I just saw an eye doctor last week, and he told me there's nothing I can do, whether it's eye exercises, diet change, or whatever, to try to help. The cataracts are inevitable, cannot be avoided. Everyone eventually gets them and have to have them taken care of. Is that true? Are there foods or other things I can do or not to avoid that and to improve vision? Well, the first thing is you want to include another doctor as part of your team. That every cell in your body regenerates, every single cell. So the question is, are you regenerating healthier cells or less healthy cells? And cataracts are like, how can I not be too graphic with the crud? It's crud that accumulates in your eye. In my mid-40s, I one day noticed that I couldn't see which flight was at that specific baggage terminal, two carousels down. I couldn't see that the sign. It was a United Airlines flight number, and I said, what the heck? Why can't I see that? And I had to walk closer to see where my bags were, if that was the carousel that my bags were at. So I went to see an eye doctor. He said, no, you're fine. You're fine. And then about a month later, I went to see another eye doctor, both ophthalmologists. No, you're fine. And then I went to a behavioral optometrist. All right, there's something going on here because I'm not seeing the way no, you're fine. Your tests are all fine. And then I went to my internist, family practitioner, my ex-wife's cousin, and we were taking our kids in, and he says, "Tom, how you doing?" I said, "Oh, good. Yeah, I've been to two ophthalmologists, a behavioral optometrist, but there's something with my vision." He said, "Well, let me take a look." He looks and I said, "Well, you've got a cataract." What? In my mid-40s, I have a cataract? The ophthalmologist missed it. The optometrist missed it. It was the internist that just looks at, yep, there it is. And he was right. Now, it's really unusual for a healthy 40-something to have a cataract. And at that point, I was doing triathlons, and I was 44, and I was scoring in the top 10% of the 30 to 35-year-olds. So, I'm walking tall, I'm a stud, I'm a healthy guy, but I got a cataract. What? So I went and had the surgery, and it took care of it. But where in the heck did this come? Oh, it just happens. There's nothing you can do about it. It just happens. And I just looked at it and said, well, that's nonsense. You're a really good surgeon, but you don't know diddly about where this thing comes from. And he just looked and said, excuse me, but I'm going to find out and I'll let you know. And so I started doing some research, and I found lead poisoning can cause cataracts. And I said, oh, well, that's not me. I don't have any lead in my life. We live in a nice area and away from the freeways, and well, maybe I'll check. And I had done a few hundred heavy metal tests by then in my career. I had the highest level of lead of anyone I'd ever tested, the very highest level. And I said, what? At 44. I said, what? Oh, you're kidding me. Really? Really? And from birth until 8 years old, we lived right across the river and one street up off the river from Ford's largest manufacturing facility, the Rouge River plant in Detroit. So I was less than a quarter mile away from the Rouge River plant. There was no air regulation for what's coming out of the smokestacks back then. And I'm riding my bicycle around every day, for 8 years and breathing that lead that just stayed in my body. So I had to do a lot of detoxing to get that lead out. It took me almost a year, but that's where it came from. And that was 25 years ago. And I don't have another cataract in my other eye. So let's see, what was your name? Samantha. You need another doctor to give you a different opinion. That doctor may be really good for some things. I'm not saying fire them, but that's not a holistic doctor that's going to investigate for you. Where in the heck is this coming from? So heavy metals is a common source, and there are other sources also, but that's what you have to look for. And that's a functional medicine practitioner for that. Let's see. Eleanor's on Zoom. She said, what can be done for neuropathy in the feet? I'm taking gabapentin, but that is a pharma solution. Do you have any suggestions?
Yeah, I mean, the same thing, postural, but I also have seen really great results with red light therapy, infrared. So either some type of, because like in our brick and mortar office, we have what's called an ultimate light, which uses near and far infrared therapy, and we put those on people's feet. That works great. Other colleagues have had great results with that. But that would be one of my suggestions, is infrared therapy, near and far infrared, like a full spectrum.
That I've heard good things about that. I have no experience with it myself, but I've heard good things. My question would be, where's the neuropathy coming from? Mm-hmm. And that's a critically important question to answer. And I'll give you one example. In celiac disease, as an example, 22% of celiacs have peripheral neuropathies. When you check them, every single one of them has elevated antibodies to gangliosides. Gangliosides are a component of the nerves. So when you have this autoimmune mechanism attacking your nerves, you get peripheral neuropathies. That's just basic neurology. And when you go on a gluten-free diet, they go away because your ganglioside antibodies go down. Now, there's also vitamin B12 deficiencies can cause that. Folic acid imbalances can cause that. Peripheral neuropathies. There's a lot of different triggers that can cause it. The red light therapy can really help with the symptom pattern, but it's not a deficiency of red light that's causing the peripheral neuropathies. But for some relief, I've heard before that it can be really effective. I don't have personal experience with that, but you have to investigate where's the peripheral neuropathy coming from. Let me give you one more example to really dial it home. When someone goes to their doctor with peripheral neuropathies and the doctor makes a recommendation, you take something, it doesn't work, you go back 3 months later, it didn't work. He gives you something else, it doesn't work, you call them and you say, yeah, it didn't work. They send you to a neurologist. You have to wait a couple of months to get into the neurologist, probably. You get in there, writes a script for something, it doesn't work. You go back a few months later, now you're 6 months, 8 months down the road suffering like this. He wants to give you something else. It doesn't work. Then if you go back to him again, if you're lucky, he refers you to a tertiary neurology center, a research center, because they take the worst of the worst cases to try and figure out what's going on. At a tertiary research center, neurology research center, they published that when the cause of neurological symptoms is identified, the number of people with antibodies to wheat is 5%. When the cause of neurological symptoms cannot be identified, the number of people with elevated antibodies to wheat is 57%. And you put them on a gluten-free diet, they get better. So you have to find out what the trigger is that's setting up the peripheral neuropathies. If you look at your feet, do you see a bunch of blood vessels close to the surface around your ankles? And nowhere else really, but just around the ankles, not in your legs, no varicose veins or anything, but just around the ankles, you see, that's a blood sugar problem. Often, that creates that environment. So you have to find out where the peripheral neuropathy is coming from.
Yeah, and I think that's for everything that we're talking about here too. It's not, just the, finding out what it's coming from, but also correcting the nutrition, correcting the lifestyle practices, the mindset, the spinal, posture, your sleep, your exercise. It's a again, I keep saying a multifactorial approach to help increase the health and cells of your body. And that's why I think the red light therapy type therapies are beneficial, because that's what it does, increases the energy in the cells so your body can actually heal. But again, Dr. Tom, that's what we're saying is we always want to find the causes. Very rarely is it one cause. Improve in the way we do that and heal is by improving the function, improving the health of the cells. And how do we do that? Well, get rid of the interferences that are stopping our body from healing at that optimal level, physically, mentally and emotionally, chemically, putting that all together. And that's, again, a big reason why I did the Chronic Pain Masterclass and why I'm putting that together.
Clarita asks a question. Hello, Dr. Tom. So nice to see you, or nice to hear you. Thank you, Clarita. She's on Facebook. I want to know, what can I do to my son? He is 24 and from age 9 months, he had celiac. He eat only the gluten-free food. What are the last studies of science for celiac? May this allergy can go away one day or not. I have hoped so much for years. In my state, haven't a method to make and to see if the allergy is present or not in his body. With great respect, from Clara from Albania. Hello, Clara. Thank you so much for joining. I know how late it is there for you. Actually, what time is it in Albania? It's got to be like 1 or 2 in the morning, I would think there. So thank you so much for staying up. Yeah, gluten-free food, gluten-free pasta, gluten-free cookies, gluten-free bread is very, very dangerous. They did a study, they published in the American Journal of Gastroenterology 3 years ago. And this is from Columbia University, Dr. Peter Green, a very, very famous gastroenterologist. And they had 804 people, and they gave them testing equipment about the size of an iPhone. I have this testing equipment myself. And they went to gluten-free restaurants and they ordered off of gluten-free menus. They were told to order 7 items off of a gluten-free menu. So that's 5,624 different things that were ordered off of gluten-free menus. When the waiter or waitress walked away, they opened their briefcase, took out the testing equipment, put it on the table. When they came back with the food, they took the food and put it in the testing equipment one at a time. 32% of everything on a gluten-free menu is not gluten-free. 32%. 54% of gluten-free pasta is not gluten-free. 52% of gluten-free pizza is not gluten-free. Clarita, I'm sorry, I have to, Clarita, I strongly recommend you work with Michelle Ross, michelleross.com. We'll put the link in here. Michelle was the director of clinical services here at theDr.com for many, many years. The only director of clinical services we've ever had. She's been by my side for many, many years. And she's a very, very good nutritionist, and she's a celiac herself, and she can work with you and your son so you know exactly what to do. Even when you can't do the testing, you'll know exactly what to do, because this is a very important topic for you and your son and so many others. Well, you know, Dr. Ryan, we've gone over time, which is always the case. It's just always the case. I want to recommend everyone, please click on the link below for Dr. Ryan's Pain Summit. 6 guests. It's going to be live, so they're interacting with you, answering questions. What a great concept. Really great concept. Also, my 10-day challenge starts March the 1st. Will be at the same time as Dr. Ryan's Summit. The 10-day challenge. The links are here for both of those events. Take a look at them. Register for Dr. Ryan's absolutely right away. And join us if you can for the 10 days and see if we can't make an impact on the direction of your health. Thank you all very much for being with us tonight. Dr. Ryan, thank you. Really a pleasure to be with you. And best wishes for your summit. And everyone, we'll see you next week.